Okay, so there's several different kinds of baths. A complete bed bath is what I'll be doing, and that is where it's for a dependent client, one that cannot bathe itself. There are self-help baths, and that's where a patient is bedridden and he or she can kind of bathe themselves but needs somebody to help, bathe the parts they can't reach or the parts that they have trouble with. A partial bath or partial bed bath is basically where we wash the areas that may cause discomfort, those that get odor, like the axilla, and we wash the face, perineal area, the back. A towel bath, that is where you replace the bath blanket with a towel that has been with a wet towel that has no rinse soap on it, and so you put the towel on them, and then you just kind of massage the towel all over them, and then you replace that towel with a clean towel and dry them off with the dry towel, And then there's a tub bath. For some of the tub baths are like whirlpool baths or therapeutic for some patients. Some people require help with them, some don't, but basically it's up to the client's ability whether or not they need help. But like I said, there are therapeutic ones, and they do use them for that. A shower in a normal setting, in a hospital setting, in a normal setting, it would be for ambulatory clients, the ones that can get up and basically, wash themselves and everything. But then there's those that are in a long-term care facility, and what they have is a shower chair that they're transported to the shower in, and the nurse does do most of the work in there as far as washing their hair and their body and cleaning their perineal area. But anyways, I'm going to do a bed bath. I would provide privacy, identify, do hand hygiene, and so first he's got his sheet on. I'm going to let him know what we're doing. This is my bath towel. Bath towel first. What the hell is it doing? And sorry, my battery's going dead. So I would replace this sheet with a bath towel. I'm going to lay that bath towel over there, work the sheet out from under it. Put that off to the side. If it's soiled, I would throw it in the laundry hamper. Okay, now I'm going to start by making a bath mitt. Basically, you wrap the rag around your hand like a little mitten. And I have all my supplies here. I got soap, water. I have gloves on. I've performed my hand hygiene. I'm going to start with his face. I'll ask him if he wants me to use soap on his face, because soap can be drying, so sometimes I don't want it used on there. Start with his eye. Wipe from the corner out. And his eyes. Use a different corner of your rag for each eye, so in case one has an infection, you're not spreading it to the other. And then I would go on, before all of that, I would put a towel under his head so that I'm not getting his bed wet. I would go on, I would rinse my rag, go on to the next body part, which is going to be the arms. Okay, put some more, rinse my rag out, soap, water. I do use soap on this part. And as I'm doing this, I'm checking for any abnormal spots on his skin, any kind of anything, any abnormalness of skin condition. I'm going to start from the distal surface and I'm going to do long strokes of the patient's arm. Okay, and then I'll wash his hands real good, check his nails. Okay, and then I would do the other arm also. Move down to his chest and abdomen. Remember, I'm trying to keep his bed dry, so I'm going to move the towel down as I work with him. And I'm trying to maintain his privacy by keeping this bath towel on him. So I'm going to wash his his chest and abdomen. Okay, cover that up. I'm going to move to a leg on one side, work from the ankle up towards the thigh. Long strokes, helps with circulation. Go to the feet. Make sure to get in between toes. And between each body part, I am rinsing my rag, okay? I'm rinsing my rag and I'm putting soap on it. And then after that, I'm wiping the soap off again with a clean rag. So, and I'm making sure my temperature is okay in the water basin. If it's not, I take it to the bathroom, I refill it because nobody wants a cold bath. So anyways, washing, getting his feet in between their toes, still checking his skin, drying that off. And I'm gonna roll the patient to his back, to his side so I can get his back. Hard strokes on the back, improves circulation or helps circulation. And then the very last thing I will do is the perineal area. So I'm going to do that, dry them all off, the back side of them. Okay, then I'm going to go ahead and put back on, I'm gonna remove this towel out from under him, and then I'll put back on his gown, I guess, yeah. And then I will put his sheet back on, or get a clean sheet and put it on. And again, we're maintaining privacy, so I'm gonna ask him to hold that up while I roll this bath towel down. I'm not going to touch the bath towel to my body. I'm going to just throw it in the dirty clothes. Then I'll I'll clean up all the bath stuff, take the basin in the bathroom, wash it out, spray it with disinfectant if needed. I will perform hand hygiene, make sure my patient is comfortable, and make sure that he or she knows where the call light is.